introduction and welcome everyone to the summit. We're really excited to kick this off and talk about a topic that we've really been discussing quite a bit. So I'm Michelle Patriquin, and I'm Director of Research at the Menninger Clinic and an Associate Professor at Baylor College of Medicine. And I have to apologize, there's a few of us here who will present today in our panel from Houston, Texas, and we are under a tornado warning right now. So hopefully we keep power and everything will be good. So I just want to introduce this topic to you all and share a bit about our thoughts around the critical importance of trust in implementing new technologies for mental health. And this idea really came from TIPS, actually. Last year, there was a venture capitalist who spoke last year, and he shared that one of the biggest issues with any sort of innovation involving technology and mental health is not, having the computer science, the software, the hardware, the technology developed. It's really having trust with patients, trust with clinicians, that really allows for the adoption of that technology in a way that could help. So, and this, just like Rachel just said in her introduction, has really come to the forefront with COVID-19, right? So we've had a COVID-19 pandemic as well as a concurrent mental health pandemic. And with that, here at Menninger, we had to have a sort of digital revolution in itself, adoption of Microsoft Teams, other platforms in order to really get all of our clinicians doing telehealth and other kind of platforms to really implement technology. But with that, the role of trust really became important, and thinking about trust and how that can either hinder or help our adoption of technology, particularly in mental health. And because it's not just trust, it's mistrust. And there's a tremendous amount of mistrust. I remember speaking with a colleague, and he said about technology and just ideas about research and implementing wearables. And he said, he's a clinician, I don't think that would really work. That doesn't really make sense. Really kind of hesitant to trust technology. But so we really have, and this is an unfair categorization, but mistrust has really been associated with technology. We see all sorts of things in the news about data breaches and issues with privacy that really start to hurt our sense of trust from a cultural level. But then trust is really associated with treatment. And so something I heard at TIPS last year was really that the providers, clinicians, that is the core of psychotherapy, psychiatric, psychological treatment. No matter what type of modality you're providing, building that rapport and trust is a central component of treatment. However, it's unfair to sort of dichotomize technology under mistrust and trust under treatment. Those two things, it's a bi-directional relationship. People can have trust of technology. And we're going to hear from our colleague from Denmark who talks about the role of societal trust and high levels of trust with technology that can actually be helpful in implementation, but also sometimes hurtful. So we'll really talk about some more of the nuances between mistrust and trust in technology. And I love this quote, drugs don't work in patients that don't take them. And I think we need to think about that with innovation and technology, because technologies don't work for patients that don't use them or clinicians. So in mental health, if we don't design technologies, innovations that are trustworthy, then and that people want to use, they won't use them and they can't help. So it's pretty simple, actually. And in this panel, we'll really discuss the phenomenon of trust in mental health and mental health technologies across multiple levels. So this is a figure that really takes Bronfenbrenner's ecological systems theory and adapted it for mental health. And I won't go into it too much detail, but right, there are multiple systems around the mental health and patients and mental health. And so we really have to think about these issues of trust, technology development at the multiple levels. What are the intersections of a cultural kind of sense of trust, facilities or institutions providing mental health services, specific services like programs and different therapies, as well as individual level differences too, and thinking about this also across time, right? Trust, and we've seen with COVID, trust can fluctuate, and it's not like, oh, I have high levels of trust, and that's what, I have trust technology quite a bit. That can fluctuate. There are events that can change our trust quite rapidly, get us into mistrusting technology, data, all sorts of things. So these are the different levels. We really need to consider system levels that all intersect in our adoption, and talking about trust in government at the societal level, right? This is the trust in government across the US since 1960, and it has declined most broadly. We also, just from a world level, I thought the United States would be kind of low. We're right in the middle from the world level. And Denmark, and one of our colleagues from Denmark will talk about, they have one of the highest levels of social trust, and what that how that can help and hurt sometimes implementation of technology in mental health. So we really want to think about trust, mistrust, and how do we build that trust in order, and how do we be trustworthy in the innovations that we design? And we really see that from 4 key levels. How does psychopathology and psychiatric disorders, symptoms interact with that? How does culture and issues of diversity, equity, inclusion interact with that? Digital fluency and comfort with technologies, and so core, the evidence base and science behind technologies. How do all of these keys relate to trust? And that's what we'll discuss today. And we really think innovation in mental health for 3 key issues: trust, we cannot forget about technology, and treatment. And so we'll talk about how all of those things intersect from multiple levels to create really exciting, I think, innovations for mental health. And so I'm just thrilled to have our speakers who will talk about trust in mental health from across different countries, but then also different levels of mental health care, and then as well as commercialization. So to get us kicked off, we'll have Dr. Emily Reiser speaking from our Texas Medical Center innovation, really talking about transatlantic and global mental health innovation. Then we'll have Lacey Tisnote, our Director of Information Technology from the Menninger Clinic, discuss U.S. and international information technology implementation. And then our colleague from Denmark, Marie Paldam Folkar, who is Center Director for the Center of Telepsychiatry in the region of Southern Denmark, will talk about Denmark mental health and the role of trust in implementation of technology at a culture or at a country level. And then our colleague, Dr. Van Kirk, will speak about US mental health and levels of care and intensive levels of care and the role of technology.